So GMI 1271 is an E-selectin inhibitor. It turns out that E-selectin and other selectins are very important in terms of defining the stem cell niche within the bone marrow. It's important for a variety of reasons, but most importantly is that the stem cell niche provides a chemotherapy protective environment, and eradication of the stem cell is absolutely essential in terms of eradicating the disease. GMI 1271 is an E-selectin inhibitor, and we added it to standard induction chemotherapy, 3+7, in an elderly patient population that were de novo, that is untreated. This included patients who had true de novo disease, but also secondary AML based on prior MDS, MPN, and they could have been treated for their myelodysplastic syndrome, but received no therapy for their acute myeloid leukemia. We enrolled a total of 25 patients. 68% of the patients went into a complete remission, including patients who had secondary AML. The study just met accrual, so we don't have long-term data in terms of disease response or survival. However, one of the things that we noted in the study was a remarkably low 30-day and 60-day mortality, probably secondary to a protective effect, if you will, in terms of mucositis stomatitis, and as a result, bacterial infections. So elderly patients with AML, one has to think about what the goals of care are. It's a relatively incurable disease. The older you are, the more likely a patient has comorbidities that may make it difficult to tolerate chemotherapy. And really, without stem cell transplantation, it's unlikely you're going to cure these patients. The upper age of transplant has evolved over this last decade or so. We, in our own institution, will transplant patients 75 and younger, realizing that patients between 60 and 75 will receive a reduced intensity transplant. So for patients over 60 and under 75 who are eager to pursue an aggressive course, induction chemotherapy is a reasonable treatment modality. For patients with comorbidities, for older patients, less is best approach, and that would be an alternative strategy. But in this particular trial, these were patients who were fit, although they were elderly, but they were fit and able to tolerate chemotherapy. So one of the unmet needs in the world of acute myeloid leukemia is the treatment of patients who relapse or are refractory to primary therapy. So we conducted a study where we tested in a phase 1 fashion escalating doses of GMI 1271, an E-selectin inhibitor, in combination with MEK. MEK is one regimen that's commonly used, which consists of mitoxantrone, etoposide, and cytarabine. Once a randomized phase 2 dose was determined, we extended that into additional 49 patients, including patients who had received up to 2 prior therapies, but one therapy had to be standard anthracycline-based chemotherapy. We've been able to show approximately a 40% remission rate, and similar to the elderly de novo trial, a relatively low 30-day and 40-day and 60-day mortality, probably arguing to the reduction in the rate of mucositis stomatitis.
Great.